Everybody file in. And this is going to be a super interesting two-part CEU today. And we like it to be as interactive as possible. So if you have questions, let us know. You can be in the chat and you can come off mute and ask your questions because this is really for you. So I'm going to start with introductions. I'm Brandy Archie. I'm an OT, also founder at askSAMIE and OT Connected, which is hosting this webinar, which we are recording and will end up in OT Connected. And if you haven't already signed up for OT Connected, you should, because that's actually how you're going to get access to DME Connected. So both of the presenters today are our partners. And in the partners tab on OT Connected, you will see links to them and also what they do and why you would use their service. So it's really easy to access. So please go ahead and log in at otconnected.com so you can be clicking through and clicking around while Courtney is talking to us about DME Connected. So I am super excited to have Courtney Richards here. He is the founder of DME Connected, which once I heard about it, I was like, oh man, this is like so needed and necessary. And I'm so glad to be able to connect and to work together. And he's based out of New York, and they are serving everyone around the country. I'm going to let him do his own introductions and talk to you about DME Connected and why it would be useful for you to help you get things for your patients. So I'm going to hand it over to you, Courtney.
Thank you, Dr. Brandy. Once again, thank you for this opportunity to speak to you all about myself as well as DME Connected. Just would like to let you know I also have some DME Connected members on this call as well too. Alice Casillas, Chief Operating Officer, and my Vice President Quan Aniki is also going to be attending. So just to let you know a little bit about myself, yes, I'm originally from New York City. I currently reside in Atlanta. We do have a nationwide presence, right? We've been doing DME Connected for the last 6 years. I myself have been in the industry for 18 years. I like to say my cornerstone has always been durable medical equipment, home health, and mental health. But my team and I combined, we have about 50 years of experience, right? So how did this journey begin? 6 years ago, we worked for some larger distributors, larger companies. You know them. You can find me on LinkedIn. We work for the Apris, the Philips and the large companies. And then we got together, myself and some co-workers and, colleagues, and we say, hey, we can build this system and we can offer it at affordable price for everyone. So what we did was that we created a simple online platform, right, that could get integrated into your EHR system, right? And then we gave it to physicians and their medical teams for free, right? We did not want the cost to be able to be, trickled down to the actual patient. So we say, hey, we're going to build this platform and we're going to give it to the medical teams and the physician, and they can use it as one centralized place when they get ready to order any type of medical equipment or services for their patients at home, right? So that's what DME Connected is. So for the last 6 years, we've been reaching out to physicians, independent clinics, let them know, hey, this is who we are. This is how you use the platform. And then within the last year, we went around and we started integrating with the EHR systems, the Epic, Discerners, Practice Fusion, Athena Health, and I'll get into a little bit later. But that was just a quick overview of who we are and what we wanted to do. Now on the back end, in order to keep this going, we got to get revenue, right? That's the bottom line. We got to get revenue to keep it going. So basically, the suppliers and the service providers, they pay an annual fee to be part of DME Connected, right? And then they pay a per transaction fee as well too. So that's basically how we generate revenue for the platform, and we've just been going out and integrating with everyone. So askSAMIE, with Dr. Brandy, they're one of our partners. We met, we put them on the platform. Automatically, people started sending her orders, having conversations. What does patients need at home, insurance base, and so forth and so on. I'm going to actually jump in and show you the dashboard on how it looks so we can actually get into the presentation. But what you're looking at right now is DME Connected as of today, right? So as of today, and we're constantly doing updates as well. What you're looking at is the omni-channel dashboard. So keep in mind that medical providers, medical teams such as yourself as well too, you can get access to it where it's cloud-based. You can log in yourself. We'll approve your account, or you can have it integrated into your EHR system, and I'll speak to you a little bit more about that. But as you can see, it has like an Amazon type feel, and that was done purposely, right? Where basically you can search for product and services here. You can enter the patient's zip code here. And then once you hit search, the AI will give you a curated list of what provider, what service provider, DME company is in that zip code and who's best to use for that patient, right? Right here, you'll see some companies just advertising their product and services. And then right down here, you'll see these individual portals that you can hop in and do various tasks that you need to do. So some of the things which is the most popular, I'm going to jump right into it, is search by patient's zip code, right? So you can actually, search by patient's insurance, I'm sorry. So you can actually click on this button. You could enter a patient's insurance, Humana. You can put in what product you're looking for. I'm going to say I'm looking for a wheelchair. The patient has Humana, and I'm in the state of Georgia, and then I go ahead and I hit search. What ends up happening is that brings up companies that's in network with Humana that we've worked with, and now that you can actually create an order and send it over to them. Just by doing this simple function, you can save your patient on their copay because now you're going with someone that's in network with that insurance company, right? So as a walkthrough, you'd be able to say, okay, I want to view this company, and then you'll see exactly what insurances the company accept, what product and services they have. You can click here, and then you'll see the order now button. So what you do, you'll be able to click on order now. It automatically bring you to the e-prescribe section, and you could just go ahead and type in wheelchair. A picture would appear. You click next, and then this screen will pop up and say, do you want this wheelchair to be delivered to the patient, or do you want it to be delivered to your office for internal use? Because we do have some physicians and medical teams that order stuff for their offices as well. Say patient delivery, you hit next, and then you get to the demographic screen. And the demographic screen is where you'll enter the patient information, you answer the question, upload the files, and send it to the vendor, right? And from there, once you send it directly to the vendor, it's a three-step process. It goes within your dashboard, and then it's pretty much keeping track of every order that you've placed and what the status updates is from those individual vendors. So when the order actually goes to a vendor, they have two options. The first option is they can accept it, and that means that they're going to accept responsibility. They're going to contact your patient to get it delivered. If there's prior authorization on a particular item, they'll go ahead and do the prior authorization. If they run into any hiccups, then they can go ahead and send you notification through the chat feature as well too. So what basically happens is that they can send you messages through the chat feature, and you can have a conversation with the service provider on what's going on with the order. If for whatever reason they realize they cannot do the order and they reject the order, then they would actually put in a message here and let you know why they're rejecting the order, right? So what you're looking at is a bi-directional system, which is an easy workflow, but it starts really from when you actually get into the omni channel and you're placing your orders. So what I showed you is how I found an actual service provider directly from the insurance portal. Now I'm going to show you if you're just going to do a general search, and we're going to use the wheelchair here as the example, right? Your patient needs a wheelchair. Patient lives in 33060, and then you hit search. Automatically, like what I mentioned before, it gives you a curated list. Okay, these are the companies that covers 33060 that can actually do that wheelchair, right? As you can see, askSAMIE is one of them too. So I can go ahead and click on here, see the product and services that they offer, right? And then I can just do that same workflow order now. Now, let's say, for example, I've never worked with askSAMIE before, and I said, I want to find out the sales rep that work for that company. I can go in and type askSAMIE and hit search. And now it brings up that point of contact person that I can reach out to, hit view, and now I have the contact information for that person. Look at that. Woo, Dr. Brandy, there you go. Right? So from here, you can find sales rep that work for a particular company. You can also find the insurance. Even if a company has a brick and mortar location, what you basically do is click here and it will show you where exactly they're located. So this right here is just showing you what product they offer. The one below is where is their actual physical location, right? So you could even do a search based off states as well too, right? And I'm just going to California, and then I just click, and then it's bringing up companies that's working with California that we work with based off zip codes. So it's a lot of different functions that you can get real fine tuned with on how you're going to find your equipment, find out who can accept the patient's insurance, right? Find a sales rep and place an order. So at the beginning of this, what I mentioned was that we started with durable medical equipment. We quickly realized that the physicians and medical team actually needed other additional services besides durable medical equipment. So that's why we have Therapy Connected, where you can actually go ahead and order and refer a patient over to a behavioral or mental health therapist as well too. That's something that you could do in the system. So you can actually get in here, find a therapist, and this is off something else off to the side that we do. Find a therapist and refer a patient over to that therapist as well too. So we want to be that centralized point, kind of like how Amazon is. So no matter what that patient need, you guys can actually get in there and order it for that patient. The latest thing that we're going to be adding, we're releasing it, and I can mention it now, is that we're going to be adding a portal for non-emergency patient transportation. So we actually just sealed a deal with Lyft Business Healthcare. Yep, Lyft as you know it. And basically, you're going to be able to click on here and send a car to your patient's home, pick them up and drop them off at your facility, location, or wherever you need to do. And you'll be able to do that through that Lyft portal. So this is DME Connected as you see it today, where you're doing the search, the general search. You can do it based off individual portals that you're looking for. So locations, you can look for clinical documents, most commonly use ICD-10 codes when you're actually creating an order. And then you have the e-prescribe button right here. So with the e-prescribe, this is where you're actually doing all your ordering. So the same product and services that you're seeing on the Omni channel, they're right here as well too. So that's where you'll be able to just pick up on it, click next, hit this, and hit continue. So the integration, and I wanted to just hit on this a little bit. With the integration, you can actually go to dmeconnected.com and you can see the EHR systems that we're integrated with. So if we're integrated with your EHR system, you can literally just put in the patient's medical record number and hit get patient details. What happens is that our system will pull all the patient information into the actual categories already. So it's pre-populated. So that helps you out with any type of manual entry. So it brought over, this is a fake patient, just to let you know. It brought that over. I go ahead and just say what physician or who's writing the order. There's two things that you still have to fill out. The length of need, 99 months, and then the diagnosis, because more diagnosis is always adding to the patient's chart. So you can add multiple diagnoses here, right? This order took me less than 2 minutes to do. And then I hit next. I answer the qualifying questions. So this was a rollator. I'm saying this patient is 5'11", weight 200 pounds, right? I need a rollator with wheels, and it already have the HICPIC codes. I hit next. I upload my files and I select the vendor. So real quick, I'm just going to make a fake order here. I hit OK. I hit next. And then I just choose boom. So all I have to do is just send a message and hit submit. I'm not going to go ahead and submit it directly because then it will go directly to this service provider, right? But then it will go directly into the dashboard. So as you can see, it literally took me less than 5 minutes to create that order and send it over to them. So I'm going to stop my presentation right there and just see if you guys have any questions for me so far that I can answer. And I'm about at the 8:20 minutes, 20 minutes so far. So I'm
Perfect.
pretty good. Gotcha.
If you guys have questions, feel free to come off mute and ask him directly. You can also put your question in the chat. I'm going
Mhm.
to start with a question.
Yes.
So, as occupational therapists,
Yes.
there are so many good use cases for this. If I'm working in private practice and my patient ends up needing a wheelchair or needs
Hmm.
a hospital bed or a CPAP, those are all coverable by insurance. And if I don't know all of the people in my area who could provide that or whose insurance, who takes what insurance, I can just easily come here. But what
That,
I'm not is a physician. And so the physician's signature is still needed on the document. So can you
mhm.
talk to us about what would have, I would have the doctor's name and information because they're signing my orders too, but what would
Got
happen on my end to make sure that it
okay.
got the right order?
So when we do set up your account under profiles, then you actually go in and you add the physicians that you work with, right? And you're going to enter their NPI number and PCOS number. Not everyone knows their PCOS number. You just enter zeros couple time, address, and then you hit submit. So the physicians that you're working with, you put it here. So when you're creating the order, like what I showed you before, it will pop up in that screen where you can just easily select that physician and the NPI number would appear. So from here under your profile, you add physicians, and that's where you can add and delete physicians that you're working with. In this screen will also be the codes for the different EHR systems. This is how we get them integrated. So let's say if you're Athena Health, you'll put your practice name, how it's spelled out in Athena Health here, and then you'll just go ahead and hit save. It's a little bit more steps to it, but that's what that profile section is all about. Make sense?
Makes total sense. And
Yeah.
then in the
Mhm.
use case that let's say I work for a clinic
Yes.
and we're integrated, let's say we're using Epic or whatever,
Yes.
and I'm not the person that usually does the ordering, but I recognize the need. I could also tell my social worker or case manager
Mhm.
about accessing DME Connected and making that easier for them to get the piece of equipment that I think that my patient needs.
That
They
is
would have access to.
Yeah, that is correct. Because on the DME Connected website, right, under for providers, so in this particular case is Epic. So if you're on Epic, right, we're in Epic, this will be the activation code, how to activate DME Connected within Epic. And it's openly there. So basically they just send an email to the Epic support team. That's the subject line. And that's the client ID. And then your tech team will be able to activate DME Connected within Epic. So once you're in Epic, then you could just click and get directly into our system. And that's the same workflow. And let me go back to that screen again. So under providers, these are all the individual EHR systems that we're integrated with. So like if it was Advanced MD, right in here, it gives you directions on how do you add DME connected directly to your dashboard. Same thing with Cerner, right? So under Cerner, that's the activation code. That's because we're already in their system, if that makes sense.
Totally makes sense. And
Okay.
then from my perspective as a provider that's also within the DME connected system, I think most people will know that askSAMIE provides adaptive equipment. That's what our bread and butter is. And it's all private pay because the adaptive equipment is not covered by insurance. But
Mm-hmm.
we're still in this system, and there are other providers there that do private pay.
Mm-hmm.
And so you have kind of like this myriad of options if they're going to bill insurance or if they're going to do private pay. All of that's available to you within DME Connected so people can get access to the things they need. And the thing that I love about it as a person who might receive an order is that there's visibility as to what's going on. So in the past, when I worked at like inpatient rehabs and my patient needed a Hoyer lift, let's say, I would make sure that my notes were correct and then just be like, let me call the local DME store. And then they'll say, great, fax us the orders. And I would fax it and it's like sending it into a black hole. And then it would be, I might be able to have a chance to follow up, or maybe they discharge and they're in home health and the
Mm-hmm.
home health person sees that we ordered this and it's not there and you don't know what's going on. And then you track down where it went to and you call them and they act like, I never got it. Right. And so at least in this system, I'm able to have direct connection with the person who's going to be fulfilling it. And then I can easily send that back to them instead of calling on the phone, putting on hold. And so it makes the whole process so much easier and faster. And you can see exactly where the holdup is at. So I love
Yeah.
that.
What we like to say, believe it or not, is that we keep everyone honest,
We
right?
keep everyone honest. Exactly.
Even ourselves, right? So basically, streamline your process of ordering the equipment. It lets you know, and everything is time stamped as well too. The company opens it, takes a look at it. That's visibility. And they accept it, and then you'll get a notification. If it's rejected, you'll get a notification. If they
Hmm.
send you a chat, you'll get a notification. So it just is about bi-directional where instead of calling and waiting for these fax machine. Even in the chat feature that I showed you, you can attach documents in there and send it over to the DME companies or the service providers as well too, right?
Yes.
So, and I do believe I see some more questions in the chat.
There is a question from Sue, who's has a private practice, but also does work for a company that provides some admin support. So would she create an account for her company and work through that, or through that company that she's working with, or would she create her own account as a private practitioner? Does that make sense?
Okay. So she's a private practitioner. She can create her own account, right? And
Mhm.
then if she's working with someone else as well too, she can create a separate account with that company as well. So she'll be able to have two separate accounts. It's just based off your different email addresses. So when you go to work with that particular company that you're working with, then you use that work to log in. And then as in a private practice, then you'll use that email address to sign in.
Makes sense, and you keep them separate and
Yes.
make sure they go to the right place.
Mm-hmm.
Um, Amazing. We
Mm,
got
do
time for a couple of more
a couple more questions.
questions. If anybody has any, throw them in the chat.
Hmm.
The thing that I will add in is the goal at OT Connected is to make sure that you have as many tools as possible to make your work as easy as possible. And
Hmm.
so when you log in otconnected.com and you go to the partners page, you'll see DME Connected there, and we'll continue to keep adding more resources there as we continue to make more partnerships. But
Hmm.
hopefully we pull in enough tools that we filled in all the holes, all the things that are a challenge when you're running your own practice or just practicing as an OTP,
Hmm.
and making it easier for you to get access to what you need.
And one more thing I want to point out. So it's actually good that everyone here do sign up for OT Connected, right? Because what Dr. Brandy is doing is building out that platform. And what we're going to end up doing is adding another portal on DME Connected. So when physicians go into DME Connected and they need to refer a patient over to occupational therapist, they'll have a direct database of where to go to. So they're not looking for anyone as well, too. So that's why what Dr. Brandy is doing, we said we're working hand in hand. She started OT Connected, and that's going to be wonderful because, like what I mentioned, over 200,000 physicians have access to DME Connected right now. Not saying that 200,000 of them are using it every single day, but through the integrations, any one of them can jump into our platform, create an order, and send it over to a DME company, home health, occupational therapy, mental health therapists. We even have non-clinical services that's in there as well, to companionship that people go ahead and refer patients over to. So that's why we say we want to be the one centralized place for everything that the physicians or yourself need to order for that patient.
I'm so glad you brought that up, because that's super important. I know we just launched OT Connect and we're just growing our community, but our goal is to be able to bring you referrals as a private practitioner, or even if you want to start a side gig. And we want to make sure that there are plenty of opportunities for you to help build a business. And DME Connect is going to be one of them because we'll be on there soon. So
Mhm.
make sure you stay connected to OT Connected so we can connect you to DME Connected. Do you see how many connecteds we have here?
Yes, it's all connected. It's all connected at the end of the day, right? So thank you all for your time. Once again, Courtney Richards, DMEconnected.com is the name of the company. And that's the website. You go there, you find information. You can find myself on LinkedIn. I'm pretty active on LinkedIn as well too. And you can find us just at DME Connected. You Google it, you'll see who we are.
Amazing. We thank you so much for your time and letting us know about the service, and we will talk to you soon.
All right, and thank you. I appreciate you. And then I think someone else is next.
Yes, I'm gonna let you hop out, and
Yep.
then I'm gonna let Mark Evan in, and we're gonna jump to LudoFit.
All
See
right.
you.
Then. Thank you all. Bye.
Okay, y'all. We like to get a lot of stuff done fast and furious, so we're gonna let Mark Evan in from LudoFit. Well, the company's called Lucida Health, and the tool he's gonna talk about is LudoFit. So we'll let him get logged in. Hi, Mark. Welcome to the
Hello,
party already in progress. How you doing?
let's do it. Yeah, hey, welcome. Super happy to be here. Nice to see you.
Yeah, thank you for joining us and spending a few minutes with us. We've got a good group of occupational therapists on ready to learn about LudoFit. And I just want to let them know that you are the co-founder and CEO there and saw the need and the problem, and we can't wait to hear you talk about it. So the floor is yours.
Awesome, awesome. So I'll start by just sharing my screen and make sure you see that here. Okay, so today we'll get right to the demo soon, so you'll see this app in progress. But I thought I'd take a few minutes to just breeze by to give you guys all a little bit of context. But as Brandy said, I'm the co-founder and CEO of the Ludica Health. We used to be called Gintronics, so we've been around for about 12 years, developing interactive programs for rehabilitation, healthy aging. Our flagship program, Gentronics, has been around. It's in about 350 rehab facilities, mostly skilled nursing. So that's been our main space where we've developed content for. And what we're here to talk about today is our newest programs, LudoFit and LudoFit Pro, which is really about taking motivating, interactive, evidence-based therapy exercise programs and making them accessible and fun and easy to use from a clinic and also for patients at home with clinical monitoring. So we're really excited. This is actually it's a new technology that's evolved that's allowed us to be able to do this. Our program that's in the skilled nursing facilities is a whole contraption with a motion sensor and a TV and a processor. And what we've done with LudoFit is really take that whole concept and make it available for individuals, therapists at their clinics could just download it onto their devices, the same device that you use for your doing your notes. You can just load up LudoFit Pro, the clinician version, and go forward from there. So we're really excited about that. A little bit about the evidence. So this is a program, our technologies, we have over 8 peer-reviewed clinical studies that have been published on the Gentronics program, and LudoFit and LudoFit Pro are like the next generation of that. So you can go ahead and search for us or find us online, and we link to all the studies. You can even search for us on Google Scholar. There's a lot of stuff written about us. There are also several more studies underway, but they really show just in general, but also specific to the type of work we do, the improvements in physical activity, gait speed, engagement, quality of life, and a range of functional measures that connect with morbidity. So that's a little bit around the evidence. Go ahead and take a look and dig into that. We're going to just cover how this program or technology in general, but this type of approach can help during therapy sessions, and really the idea of bridging the clinic and the home. So basically being able to extend your care visits and your coverage beyond the clinic, so you can have that too. And then I'm going to show the program. But don't worry, we're going to go fast. I'll be able to show you. And Brandy, if you have any questions or on behalf of the group or anyone else wants to jump in with questions, I'll put my chat right up here. So anyone wants to type something in, I'll be right there to answer your question live. So okay, so let's start with the therapy sessions and looking at technology around that. So, these are the challenges in the therapy clinic that we're focused on based on our deep conversations and research and understanding. Patient engagement, keeping patients motivated, engaged during their therapy sessions, time constraints, high caseload versus administrative demands, enough said. Complex cases, comorbidities, cognitive impairments, and bringing all those pieces together and kind of managing around that, a challenge. proving value, demonstrating through your notes when you're going to insurance to show measurable progress for a range of different reasons, even for the patient's own ability to see and digest their own sense of progress. That's really important too. So those are among the many challenges. Obviously, this is not the fully exhaustive list of what you guys are facing in the clinic, but this is what we've been focusing on. We've been really tuned to when we develop what we've developed. And so really looking at each piece and trying to really help that area. So patient engagement, our approach is gamifying therapy. You want to take traditional evidence-based exercises and turn them into something fun, interactive, using video game interactions that patients actually look forward to. And we have so many examples of that, and they really do look forward. Personalizing the exercises, that's a key thing. If it's too easy, too hard, being able to create an experience or scenario, an exercise scenario for your patients that really fit that just right challenge, feels relevant and achievable, and also getting that immediate feedback, that real-time biofeedback. When you make a movement that's right, you get the feedback. If you're moving a movement and it's not quite enough as far as you need to go, you're going to see it interactively, quickly. You're going to see, oh, I need to move a little bit further. So that's a really important part of the patient engagement. Time constraints. Being able to have ready-made evidence-based exercises. Obviously, you're still planning, but not necessarily from scratch. These are ready-made in scenarios where you can set up reaching exercises, squatting, weight shifting, sidestepping, core strengthening, a whole range of elements that you can choose from. Integrated documentation tools. Every time the patient is performing, the program is tracking the movements, measuring the progress, and plotting it so you can see it. And portability, so you can take this where you want. If you need to go to a specific part of the gym, you can just take your computer with you. The patient basically is 4 feet away, and you can see this is an example of the program being used in the clinic. So complex cases, looking at that. So these are adaptable exercises. You can adapt them in terms of intensity, duration, difficulty in real time to meet the needs of different types of patients. So you can lower the type of challenge in one dimension, but raise the challenge in another dimension. We have elements around cognitive too, which we'll talk about. Inclusive design. Obviously, with the type of patients that we're working for, well, maybe not obvious, but the types of patients that this program was really designed for was for older adults and individuals with cognitive conditions who often overlap with older adults. So and we do have a lot of younger populations, PDI, you can imagine, with games, younger individuals really using and loving the program. But that it was really designed for the older adult, both in terms of the clinical goals around strength and balance, but also the creative elements, the engagement elements. This is you're going to see it's all about world travel. Each exercise takes you to a different destination around the world. So it's something that we really did a lot of careful consideration about how to really resonate with the type of people that we want to reach. And also the cognitive, as I mentioned, cognitive dual tasking, integrating physical activity with cognitive challenges, and I'll show you some elements around that. And then proving value. So you get detailed progress dashboard. You can see objectively patient performance, balance, strength, reaction time, cognitive elements. You can customize the elements. You can share them. So that's there. Like I said before, you could share them. It's easily reporting, and it's based on obviously best practices that you can then use to inform the next stage of the patient's journey. So that's a little bit around the key, what we're doing, how we're thinking about it, why we do what we do. And I guess the next thing is first let's talk about another key element, which is the workflow, before we show the program, just so you get an idea what the workflow is all about. So you've got You know, you can send patients home with a, you know, piece of paper or, you know, something that shows pictures or videos. Another approach that this is really where we're breaking ground is to send them home with an interactive experience that you can then set up for them, customize if you want, and watch the progress happen. And then in terms of continuity of care, basically the therapist, you guys could, during your therapy sessions, use the pro version of this program, and you're going to be getting free access for 12 months as part of your participation with askSAMIE. So we're excited for you, and we'll let you know how to do that. And then you set up a patient, you can basically put in their email address, and you can get them invited to the home program. Patients get a 30-day free trial, and if they want to continue the program, it's $15 a month. But between me and you guys, while they're doing their trial, they'll get an offer for $12 a month. So you can tell them it's $12 a month, and that's that. And they can cancel anytime. There's nothing. It's pretty, and no credit card to get started. I shouldn't. It's really designed to be person friendly. We're not trying to catch people. If they want to use it, if this is valuable to them, then we really appreciate it, and we'll make it worth their while. So, and I'll show you. I'll send you a link, and I'll share it with Brandy. You can go ahead and take a look yourself. And then finally, we're going to get to the demo. So we have a few minutes for that, and then questions or anything like that. But let's go. Okay, so I just shared my screen. This is what it looks like when you're about to log in. I have a bunch of users that are kind of like test users and stuff. I'm going to go ahead and log in with my main account. So put in my password. And here I am. It's a very simple user interface, and it's very designed to be clear for therapists to get started pretty quickly. So I got my list of patients here. These are all kind of test and demo patients, so don't worry about that. You can see who has a login, active login from home, who's been invited. I'm just going to go ahead and continue as my own through my own account. So continue as admin here. So what do I see here? I've got the month. So I haven't been using this account very much over the last few weeks. You know, it's been summer, and I haven't been very compliant with my program. So you can see
Please get the program done. Get your exercise program done.
0 minutes. It's very embarrassing. Let's see. Oh, look at that. April, I had some big minutes there. Okay, anyway, I'm a little embarrassed. I should have primed up my account before doing this demo. But anyway, here we are. I've got my today's program, which is a recommendation from the system itself. You can go and start the program or you can go and browse the exercises. What we're going to do is we're going to browse the exercises to start. What I will show you right now, actually, before I do that, is that I haven't done this 30-second chair stand. This program also has the 30-second sit to stand test baked into it. So I'll go ahead and do it so you could see.
Today we're going to do a 30-second
So this is the video. So the demo, like a tutorial video of how to do 30-second sit stand with our program. I'm going to skip it.
Results determine your starting level.
I'm just going to put that over here. Tells you how it works. This is why we're doing it. It's a 40-second video. I'm going to go ahead and skip it. And it asks me to move back and sit down. So it sees me over here. You could see, actually, I didn't really emphasize it, but it's tracking my movements with the web camera. You don't need any special sensors. You don't need to wear anything. You basically load it up. It sees me on the screen. So here I am. So it's asking me to move back and sit down. So I'm going to just back up with my chair. Few steps here, so I'm about 4 feet away. So it asked me to stay seated over here. And okay, so the first thing it's asking me to do is, like, when I'm ready to stand up and the timer will begin. So you guys all know the 30-second chair stand. I gotta sit and stand as many times as I can in 30 seconds. So as I get started, here I go. The timer is going, and I'm doing this. This is something that a patient could do independently. You can do it with them too. You don't necessarily need this system to do it, but actually the program, you can set it up to, for example, if a patient's at home, to do the 30-second chair stand maybe once a month or once every several weeks, and then you can actually follow them remotely, you can see their progress over time. So, okay, 10 times, not bad. I've done a lot better. I was kind of talking, so that was that's that. So I stood 10 times. So basically, what it does here is it actually sets up my my program. It also customizes the program based on the 30-second, based on the results. So it's going to slightly adjust the difficulty levels. And then here are the exercises you've got. You've got weight shifting and squatting, balance for balance and lower body strength, and it's all about skiing the Alps. That's the game. So you basically have 3 ways of describing what's happening here. The exercise itself, the clinical goal, and the interactive experience, what you're going to be doing. So the goal that you're going to be doing weight shifting for the purpose of balance, and you're going to be skiing the Alps. We've got sidestepping and reaching for dynamic balance. And it's a Thai rock climb. You've got marching in place and reaching for cardio and dynamic balance. It's a Tour de France cycling experience. Trunk flexion, focusing on postural control and core. Bilateral reaching, upper body strength and functional reach. We've got dual tasking, memory, sidestep, and squat. And then we've got another dynamic balance pickleball game. It's one of our newest additions. We're always adding to the program. So let me just quickly show you. I'll start with this activity. So you got weight shifting, squatting. You can always choose seated or standing position. You choose the duration. You can choose the challenge level. So I'll start with challenge level. Just put it right in the middle. Challenge level 5. That's it. You press start and it kind of loads it up. Not kind of, it loads it up. It's loading up the game, the activity, and basically we created a true to life Italian Alps ski resort. It's really important that, so it asked me to stand up and move back. So I'm going to stand up here, and I've got 2 web cameras. So one is from the program itself, it's tracking me, and one is for the webinar, so you can see me kind of from the side there. But they're 2 separate. Okay, so here I am. I'm standing in front of my my laptop here, and here I am. So basically, you can see me at the bottom right there. You can see what the camera sees. So what I'm doing, I'm weight shifting. This is a weight shift and squatting. So I'm weight shifting to the right, weight shifting to the left, and moving this. So basically I'm focusing on, I hope I get some squats too, because I only did it for chose 1 minute, but here I am. I'm weight shifting to the right. So now I'm kind of moving through this obstacle course, this slalom course, but I'm focusing on as I shift to the right, skier moves to the right. As I shift to the left, skier goes to the left, so you can get a sense of that. And then here I am, I can choose in different directions. Here comes a squat. So I'm squatting, and there's a little squat indicator there. As I'm going, another squat. Okay, and I continue along my way. Now I'm in a little bit of a glade area, so I can ski around these trees. Okay, so this is focused on static balance, really focused on weight shifting. Okay, and then I reach the end. Okay, beautiful. Great job.
Lots of motivation in there. Hey, my question is, if you had a walker in front of you, would that throw off the camera?
Not at all. Not at all. That's works definitely. Works very well with a walker, wheelchair. Yeah, definitely. So what I'm doing here, you're seeing this Mont Blanc. Part of the multiple elements of engagement that I'll talk about after is that you're not just exercising when you're in the activity. We have a whole suite of mountains that you're actually climbing through exercise. So I'm climbing Mount Washington. Every time I do 10 minutes of exercise, I get a little bit higher in the mountain. And then once I reach the top, I go to another mountain. So that's another level. Here it's asking me to rate your level of effort. So you could do this in turn, you can set your level of effort. Let's say, okay, it was a bit easy. So it tells you you're on challenge level 5. Would you like to increase the challenge level? So there's this is how the program is able to follow the patient. As a therapist, you can set the level as you want discreetly, or you can have the program kind of follow along. So let's say I'll increase the challenge level, and here we go. It's going to unlock challenge level 6. Okay, new challenge level unlocked. So that gives me best. Here I'm back here, and you see in legs I did 1 minute. Total time 1 minute, so you could see that moving up along there. So I'm going to show a couple more as we go, so you can get a sense of the range of elements we've got here. So next one I'll show is actually I'll show the tie rock climb. So this is a sidestepping dynamic balance exercise and upper body strength. So I'll do this one in standing. I'll do this and I'll get it 1 minute, challenge level 5, and I start it up. Okay, and after I'll show this, I'll show some of this. So this is basically a Thailand, sort of a tropical environment that we bring the users to. Oh, zorbing. Yep. Maria, I'm going to show zorbing because you mentioned it. That's coming up next. Okay, so I'll do this for 20 or 30 seconds, and then I'll show you the zorbing. It's a great game. And it's actually based on a very intriguing sport that comes from New Zealand. So you're going to learn a little bit about that too. But I'm sure, so here we go, back to the rock climbing. So here I am sidestepping. So I'm stepping to the right, stepping to the left, keeping to the right. And I got to be careful not to step too far, but I'm stepping pretty good. Now to reach my hand, got to collect those stars. This is a little bit of a tutorial section, and you can see me there. Step to the right, and now I got these cargo nets. So what do I have to do? It's showing me with those hands. So I got to do those hands. So here we go. I could do this with one hand or two hands. So I can just pump with one arm if I want, or if that's my capability. And again, no path is wrong. Can go in any different direction. Here we go. Continuing along my way. Pump up, pump up. Okay, 5 stars. Okay, and now I'm doing sidestepping and arm reaching. Again, you can do this with one arm too. So pump, even with the left side, almost there. And I go along my way. And let's see, I'm almost at the top here. Up. Oh, you see, we're at the top. Let's see what happens. Beautiful. We have some fireworks happening there. Okay, there we go. So great job, I did it. Full 5 stars in that one. Tells me my exercise summary, how many times I raised my arms, exactly what my distance sidestep. So I actually I sidestepped 65 feet with that, which is not bad. And you can see I'm slowly climbing up Mont Blanc with my exercise. I'm gonna just put the measure at just right, and we are back. So that's that. I'm gonna show the zorbing a game next. That's a core strengthening exercise. I'll do that one in seated position, but I'll show a few things in the meantime. So we've got a few things you can see here. You've got exercise statistics. This is kind of not much statistics now because, like I said, haven't been very compliant myself this month. So you could see my 3-month average, what I did last month, and this month meager. Really not good data for me this month. But you can go to the more info and you can see time exercising in terms of my 3-month average. So my 3-month average is pretty good. Well, pretty good for a person who demos the program. It looks good, but you can see what I did last month and I did this month. So I'm working my way up. So I got 1 day left of the month. So you never know. Maybe tomorrow I'm going to come back and try to beat my 3-month average. So that's in the arms. You can go and you can look in legs, the same thing. You can see weight shifts, distance sidestepped. You can look at core, squats, trunk flexions, cognitive elements. And then we've got Mont Blanc. So this is the mountains that I've been climbing. This is more for patient engagement. So it says, I've climbed Mount Fuji, I climbed Mount Hood. It's not a clinical element, but it's a clinical in the sense that it's really supportive of patient engagement. That's a really important part of it. Okay, I'm going to go and show the zorbing exercises since that was some curiosity came through the crowd about that. So I'm going to show that one. So this is trunk flexion. Here we go. So I'll click on that one here. Zorbing, I'll go do this one in seated position. And I'm going to just, again, challenge level 5 so you can see the balance. And this one, actually, I'll show quickly show the tutorial video without the sound because I don't want it to interfere. But just a second here. Oops, 1 second. I'm actually going to skip that for now and go here. So here, I'll show you the tutorial video. So basically this is core strengthening and back pain. That's what every activity, by the way, has these tutorial videos. And this is in New Zealand, and you can see they're zorbing. You see people inside the balls and they're rolling around. That's zorbing. So we're inspired by zorbing, but we're moving the ball with the tilt of our trunk. That's all I wanted to show. So I'm going to go back to resume. And before I do that, actually, I'm going to just go and do my assessment, well, my calibration. So it asked me to move back and sit down. And here we go. Can't see your hips, so it asked me to tilt the screen forward. So there's a few usability elements. You're dealing with a motion sensing program, so you got to tilt the camera pretty well. Here I am. So here I am. I'm tilting. I'm moving to the left. I'm moving to the right, and I'm moving this ball through this maze. And I'm going this way. Here we go. And moving forward, moving to this way. And here, so kind of navigating. So this isn't so much about range of motion as it is about really precision. Now I got some challenges here. So I got this thing that's sort of like, okay, let me move fast. That's a little bit of a tough one. And then some areas have no walls, so I have to be really careful as I go through it. So this is all about core strengthening. And then you have another challenge along the way. So you've got these sort of doors. I gotta go and find this. Yeah, okay. Oh, there we go. Got through this second challenge, second checkpoint. So that's this activity. All kinds of different challenges that you can get to along the way, but what it is about, it's all about core strengthening. It's about controlling that ball through the maze. Oh, this is the wrecking ball. I think I'm at the end here. Yeah, that's it. I didn't get to the wrecking ball because I only put it as a 1 minute game. And again, 43 trunk flexions. So it's amazing how many I did in this 1 minute. I was really, doing, almost one per second. And I go continue my way up Mont Blanc. I rate the level of exercise in the program, or level of exertion. And okay, so I showed a few. I can show a lot more, and I think you guys can go in there and what you would do, by the way, is you would go into the program. I'm just gonna share my screen again here. You can go over here, and I can even put this. Sorry, let me go back here. See if I could. I'll have to put the link in the chat, but I'll just do it right away so you have that. But you go
and
in
we'll
there.
also make sure it's updated in
Yeah.
Connected and the partners page too, so it'll be there as well.
Okay, great. So that'll be there, and then you can put in you can put just askSAMIE. So if you go, let's say you go over here to the.
We don't see your screen. There we go.
There's the site. You go to get started down here. You over here you put in your element, and this is promo code. Okay, put askSAMIE. Just put that in there. Okay, caps or lowercase. You put in your information. First name, last name, where you're from, a little bit about you, promo code askSAMIE. Just do that, and we will take care of you. Okay. All right, that's all I wanted to show. We have a few minutes left, but really not much time. But Brandy, how would you like to do? You want to see more, or we want performance data? Just quickly, so you could see, there's like a really deep performance data that the program offers. You can go and you could take a look every single day that this patient performed. You can see which exercises they did and every single element, and you can export, you can select the date range, you can export it to PDF, to Excel. So that's just the last piece I wanted to add. So
thank you so much for sharing this, and you gave us all the details, and OTs are excellent at figuring out ways to grade things and what they would do to use it. So I'm sure everybody's got their wheels clicking. The one thing I think you left out is it's really hard to start a business, and it's really hard to create technology. So just tell us why you did all this.
We do these things because they are hard, not because they are easy. I don't know, what's that JFK line? I like building things, like that's what I love to do. So this is my passion, and That's really the key answer. And then, you know, you move forward to something, and then you kind of fall in love with a problem, you know, like I was working in science centers. I was doing interactive installations at science centers, and that's where I sort of came into contact with kids with developmental coordination disorder, and kind of learning a little bit about that challenge. And then through that was actually, I had started wanting to do some interactive technology for that population. But then my co-founder at the time, his father had recently had a stroke. And then I didn't have any my family. Oh, I did have family that had stroke, but I wasn't really thinking very much about the clinical journey of it, just more on the human element when my grandmother had a stroke. But when my friend's father had a stroke, we really kind of fell in love with the challenge of like, how can we help? What can we do? How can we use interactivity? How can we use biofeedback? So it's really, you know, seeing a problem and kind of falling in love with it, and saying and really getting excited about what you can do in that space. So
Thanks for sharing that. I think that's like so important to understand. And I'm grateful for the intention level that you have built with this, because so many things, especially stroke and neuro, need high levels of repetition. And it's so hard to get it, and to get them to do it when they're not at the clinic. So in that little hour that we have to work with them. So I'm grateful for your partnership with us. And thank you for coming on and sharing it with us this evening. This has been recorded. It will be in OT Connected in our knowledge base. So you can just search for it there and get that recording or file any details. And also we'll make sure that in the partner section, the link is updated with all the details and the coupon code, so that y'all can get started using it. And you can always reach out, and we'll get Mark's contact information there in case you have questions or want to connect with them on LinkedIn. But that is the end of our hour, and I want to respect everybody's evening. Please do fill out the survey. That's the way you get your CEU. So if you click through that, it'll just take you a couple of minutes and get your CEU certificate or the materials you'll need to share with your state if you're outside of Kansas or Missouri. And we really appreciate everybody for being here.
Brandy, one
Oh,
quick
yeah.
question. Mark, where do we sign up? Because I'm on your website and
so yeah, I'll put the code in. I'll put the link in.
Okay, great.
In the chat. So there's the link, and then the code is askSAMIE.
askSAMIE. Okay, perfect.
Yeah.
Okay, thank you.
Amazing.
That was excellent. Thank you.
You're welcome.
Thank you, everybody.
Thank you.
Thank you. Bye.
Bye-bye.